Let's take a look at this. So, honestly, like like we were saying, it does really look good. Okay, so I know the concern and everything like that. We get that, but it's looking really nice at this point. Okay,
but it leaked a lot.
it leaked a lot, and that's just so. Whenever we go in there and do surgery, your body's going to react to it, and it's going to say, "Oh my gosh, what happened?" And we opened it up, so we made a huge pocket in here to clean everything out, right? So we moved. Normally your skin is attached to your muscles underneath, but we lifted all that up to make sure we could get fluid in there and wash it out, make sure we got any bacteria out. Well, then the body has a space in it, and it's called third spacing. So the body fills it up with fluid, which is what happened originally too, in a sense. For some reason, the body decided to make fluid. So the body made fluid after we had the surgery, and then pressure just built up enough so when you popped the stitch, that opened it up. Normally that fluid would stay in there and you probably would have been swollen again, which is when Dr. Mao came in and goes, oh look, the seroma didn't return. It's because you've been leaking on the outside instead of the inside. There was no way to avoid fluid in this at any situation. If it had stayed closed and that skin hadn't opened, there would have been a bubble again here, which would have been okay, but we know it wouldn't have been an infected bubble, if that makes sense, because we washed it out. But there's still going to be fluid. You can even feel there's still fluid in here. This is why everything is a little tight around it, because there is excess fluid, which is normal after surgery, okay? That's what swelling basically is in the body, okay?
So after surgery, it leaks?
So it leaks. Now, not everyone sees or feels the leaking because not everyone's suture has one that pops, that opens up in there. It leaks normally inside the body, if that makes sense. Fluid is the way your body, so when we went in there, the body sees surgery as an injury, right? Mm-hmm. So the body is just sending white blood cells and everything. It does it via fluid. So that's why when you sprain your ankle, when you fall on your wrist, everything swells up. It's fluid in the body. Mm-hmm. It does the same thing when we do surgery. The reason it leaked on you is you just had an area of the skin that opened up. So it's not so concerning as much as you think.
But so from the beginning, everything was great. I was doing really great. But my arm always ached.
Mm-hmm.
Always. Remember, you even squeezed my fingers.
Yeah, and they were swollen.
Said everything was. You go, well, you got blood flow. It always ached. Even I told my physical therapist, man, my freaking arm is killing me. Always killing me. When you guys did Wednesday and Tuesday, there was no pain. Mm-hmm. The first time since surgery, I had no pain in my arm.
Well, a lot of that too might have been because we had you under the anesthetic. So we had a lot of anesthesia in that arm to basically make it go numb for a while too. So that could be it. But the other thing is we probably decompressed a lot of the fluid in there, right? Like removing it. But it's going to come back. And eventually your body will resorb it. Right now what it did is it pushed it out because it had an opening. Your body's going to resorb it. Are we
going to get rid of that opening?
So this opening is already starting to close, if you can see. It looks pretty good. So in a sense, I'm not going to do anything more. It's a little early for the sutures to come out, but I'm going to have my MA come in and steri-strip it closed again. It might continue to drain a little bit, but that's okay because if the fluid keeps coming out like this, there's less fluid in your body. We just have to get this superficial area to close. And it's only, if you look at it, it's only maybe 5 millimeters of an opening. Not very big at this point.
I don't know millimeters.
So half of my finger width. Literally half of that is all that's open at this point. So like an eighth of an inch.
So that Band-Aid you guys put on there last time, we don't have those? You guys don't have those?
So we do. But we don't necessarily, that Aquacell bandage, I don't necessarily need it at this point because I want something that's a decent bandage, but what it's going to do is it's not going to hold as much fluid if there is fluid draining, and I want to pull fluid from there. I also want you to be able to probably change this once a day if it is still draining. So I'm going to put steri strips on that try to hold this together, and then I'm going to have him dress it with more gauze like this, okay? And then we're going to give you some extra material so that you can change it daily to just pull fluid off, because there's probably going to be fluid like this coming off of it for the next few days or so, okay?
So I can't move my arm?
So no, you can move your arm. We just don't want you probably doing too much overhead at this point, because we don't want stretching the skin out too much. We're trying to let it close. But moving it around, kind of doing this kind of thing is okay, and probably low-level stuff is okay.
When I lay down, I like to lift my arm out.
You can lift it up like that. That's fine. Yep. I just don't want you probably trying to get up there. Well, I know you can't, but trying to get up like this yet, okay? We just want to kind of let this close up, but it doesn't look bad. It looks like it's doing pretty good. Yeah, I think we'll be fine. Okay? And then I want to see you back probably in about a week just to see how it's doing. But I don't see it. It's draining, what we call serosanguinous fluid, so red or yellowish fluid. That's not infected. That looks okay at this point. So it does look better. Yeah,
So the
I'd say it's
achiness
fine.
has come back in my arm. What is that
It's
from?
mostly just fluid probably in there again. Okay, so fluid's going to fill into this area. So when you are sleeping or at night when you're laying, even putting a couple pillows underneath it to
Yeah.
kind of keep it
I
to
do that.
drain down like that is going to be good. But it's going to take time for that to go away, unfortunately. We replaced that whole shoulder, so there's bone still healing in there and everything coming
The
down.
bone's still fine.
But sometimes it just draws that fluid. So it's just a process, but we'll get you there, okay? So, but yeah, I wouldn't worry about this too much. I can understand where you were worried with it, and that's why I wanted to bring you in, but this looks good at this point. It looks fine.
Okay.
Okay? All right? Trust the process. We'll get you there, okay? I know. So, it looks good. All right, let me grab a few things to try to get this dressed up. Actually, I can bring you into a different room now if you want to. I got stuff over this side. Let's throw you in. Let's throw you in right here. So we can get some steri strips on you. But I'll clean that up a little bit around there. Like kind of sit up on this part. That way I can just be eye level with it, but it looks good. Sorry, no one's here anymore. We had a busy morning today. And then Dr. Mao got called to start his surgery early.
The surgery on Tuesday was fabulous.
Felt good? Good.
Yeah, I was like,
Not too painful or anything crazy?
surface pain doesn't bother me.
It's the deep stuff, yeah.
Yeah, I've cut myself, fingers off, everything. I've been in construction most of my life.
Uh-huh.
And, so surface wounds are usually nothing to me.
Sure.
But when it was aching in my arm, and I tell you,
Look at that deep ache.
well, you gotta remember, so 3 weeks ago, it was just hurting so bad.
Sure.
And then there was no swelling. And then it started swelling on that scar, and that's when I called you guys.
Yep.
Then you drained it.
Yep.
And then I was like, okay.
Didn't give you much relief then either.
Well, that minute it did.
Did.
But the next day, I didn't hear from you guys, and it kept worse. I called like 6 times.
Yeah, and we were waiting for that culture to come back, and they just took forever on that, unfortunately.
Well, I talked to some guy, and I was like, dude, seriously, it's just getting way worse than it was. I'm gonna have to go to the hospital. He was like, well, we don't know. And I was like, okay. So I went to the hospital, and they're like, we're not touching that.
Yeah, and that's the thing with these, when you drain it, the fluid just came back is the problem, and that can happen with these, unfortunately. Nothing I'm super, like I said, concerned about. There's just your body is making fluid. I'm gonna pull it a little bit here. So
Yeah, pinch it close. I don't want it to leak.
Well, it's still gonna leak, unfortunately. I can't make it watertight, but I'm gonna do my best. You can shower over this at this point, okay? Clean running water is okay. Just no soaking it, okay? So no bathtubs, pools, hot tubs, anything like that.
Mhm.
And then you just dab these steri strips dry, and they should stay on. I'm going to reinforce a few more areas here.
You're gonna give me some?
And I'll give you a packet, yep, so that if they come off, you can just kind of replace them, okay? And then what we'll do is...
My wife is traumatized.
Is she? Sorry, tell her we're sorry, but honestly...
I saw it pop, it squirted out of this
that
water.
much water, yeah. And it's okay that the body's leaking like that, it really is.
Squirting.
Squirting, leaking.
It's a Bugs Bunny cartoon all
Yep.
the way.
Yep. I remember my first day draining an abscess in the ER when I was a student. It was so tense, so we put the needle in, and we had face shields on. Luckily, it popped all over us like that, and I was like, that took me aback first, because when you don't, just like you, before I was used to it and know what's going on in the body, you're like, that doesn't seem right. And then everyone's like, no, it's fine. You're like, okay, if you say so.
Well, like I told my wife, I said, you're not used, I go, in construction, I was the surgeon.
Sure.
At work, I stitched people up.
Together and everything, yeah.
I carried nylon thread, and
Yeah, you got to do what you got to do at that point.
they get them enough to get to the hospital.
Yep.
And I stitched many hands with a saw cut.
Saws cuts, yeah, exactly. So, and
It don't bother me.
it doesn't bother you as much, but yeah, I get it, taking care of it, and you're worried, she's worried for you.
She's worried, and
I get it.
I'm diabetic now, so when I'm sitting there laying and I can feel it pulsating,
Yep.
then I feel sharp pains going, I'm like,
what is going on. But no, the diabetes, this isn't gonna hurt the diabetes
No,
as so
I
much
know.
as the
The
diabetes
diabetes is gonna slow
hurts
my
this
growth.
and slow this,
Yeah.
but it looks pretty good, so. Let me get a couple more things to help reinforce, like I said, this is what I want you changing.